You might just notice somebody on the left-hand second side. Di was on a trip recently, and there she is. But being a trained nurse, she can do more than I can as a psychologist. Although helping some of the teams when they've had some really challenging days is quite helpful to be able to talk things through. Where do we go? Well, we go to all those countries listed on the screen. For example, in Bangladesh last year we did 6 programs. One of them was an emergency management of severe burns program to teach the locals how to deal with burns in the first instance so the contractures aren't as bad. We have a microsurgery training program, and we had 42 local plastic surgeons from Bangladesh last year went through a training program in microsurgery, and you see them sitting there working on chicken legs. It's fascinating. But 6 different sorts of programs based on the fact of what the Bangladeshi people wanted. We don't go to a country unless we're invited. In Mongolia, there's emphasis on training the anaesthesiologists, and they wanted training in anaesthetics, how to deal with blocked airways, all those sorts of things. So the team does that. In Mongolia, there's an emphasis too on training anaesthetists. In Laos, the program's been going there for about 14 or 15 years. The first part of our time there was mainly cleft lip and palate and training the doctors. Our surgeons no longer do cleft lip and palate in Laos because they've trained the local doctors. We have a nurse who's been going for about 15 or 16 years. She goes ahead of the team and goes out with the local team to train the nurses in the rural hospitals because we don't have access to them, to look after patients, young children who've had cleft lip and palate operations, and there's a special care that they need post-operatively. So she goes out and does that training before our team arrives. We now have an agreement with the Mahasot Hospital in Laos to actually undertake burns treatment. So we'd like to get ourselves out of a job, really. It's a great ambition. But in Laos, we've done it with cleft lip and palate. In Fiji, last year we had 6 programs, a number of them, but one was a little bit different. We had a speech pathologist who went on a program to train the nurses and staff about dealing with children post-operatively after cleft lip and palate. So we have physios involved, speech therapists involved, and we often partner with other organisations. For example, in Laos, there's an organisation run by the physiotherapists, British physiotherapists. We partner with them to look after our patients after we leave. So I'm not going to bore you by going through all those places, but we go to all these places. Let me just say that you don't want to get behind an Interplast team when they're going on a trip, because we have to get our luggage through. We all take as little luggage as we can, so we can use that excess luggage to take all this equipment. We have to take all our equipment. We don't want to be a burden on the hospitals we go to. Sometimes they don't have the equipment that they need for these operations. And sometimes some of the equipment's left behind to assist them. So we beg, borrow and steal excess baggage from all the team, and we plead with the airlines to give us some extra and waive their extra baggage fees, because we want to keep our costs as low as possible. What sort of people do we treat? What sort of conditions do we treat? We can treat mainly cleft lip and palate, 31%, and then trauma reconstruction, people who've been injured, damaged in an accident, hurt in some way, and then burn contractures and burns, 22%, and surgery for tumours, 19%. So you can see there's a variety of conditions that Interplast deals with. And the doctors have to be pretty flexible because they face all sorts of things. As I said, they all turn up because they've heard about the Interplast teams there. Sometimes you get someone who turns up and wants their tattoo removed. Well, I can triage them and tell them we don't remove tattoos. But most, 99% of them, are tragic cases, kids who've lived with a disability for years, who've been laughed at, who've been mocked. Many of the communities have some primitive views and believe that devils have got into the children or the family and the child's ostracised, not allowed to go to school. So they're desperate to get treatment. And we see here a waiting room at Mount Hagen Hospital on the clinic day when 216 people turned up to be treated. So more arrive than can be treated. And they all dress up for the occasion. And as I said, it's an awfully hard decision to decide who'll be treated. Number one criteria is that we can restore function, that we can restore the person and rebuild them, repair and rebuild their life. And the volunteers are committed to treating as many people as possible. You know, you see those surgeons, they go into the theatre at 7 o'clock and you've got to cajole them to come out and have something to eat, and they're still there at 7 and 8 at night. They just work round the clock to do look after as many patients as they possibly can in a trip. Over the last 31 years, I'm going to say 81 years, 31 years since 1983, we've run over 600 programs. We've had more than 37,000 consultations, and we've undertaken 22,000 surgical procedures. We've trained countless medical staff, and last year we conducted 51 programs, and the plan for this year is between 60 and 64 programs. As I said, the demand exceeds by miles the money that we have and the number of volunteers we have. I just want to show you some examples of how we can change young children's lives. Here's a young boy, and more surgery is being done in country as we train the surgeons because if they bring them back to Australia, they don't get to see. They see the after effect, or what we've done. But if we can possibly do the surgery in country, it means those people get the opportunity of training. Here was a young boy who presented with a tumour, and here he is, we went back a year later. What a difference. Now this one is amazing. This is a young girl in Indonesia who presented having had a bacterial infection in her face when she was about 8 or 9. She was the sole breadwinner for her family, and you don't find living like this very easy, I imagine. She had trouble eating, and you can see how distressed she is. The surgeon who looked after her, I think they had 3 sessions over a period of time, 3 operations that they went back and they trained the doctors, local doctors with them, they worked with them, and here she is, a year and a bit later, and she's now training as a nurse. That is worth everything we do. We've changed a life so significantly. She's learnt to put pancake makeup on, and that's to show when she's not made up. But isn't that different? And I think that's one of my favourite Interplast slides. It gives me shivers down my spine when I see it, because I think she could have lived like that for her whole life, and it would have got worse because she would have had problems with her jaw and just a myriad of things that she went on. And I believe, and I think I'm right. We haven't followed this up. Is it true that she met a young man?
I heard that. I will follow that one up.
Well, the surgeon told me that a young man came in with a similar condition, and they sent her down as a young nurse to show him the before photos and what they'd done, because he was a bit anxious. And he said to me that they were going out. So we have to find the rest of that story.
We love a love story.
It's a good story anyway. I don't think I'll change it, but it does make a difference to people's lives. This is one of the nurses in training. Again, it's about getting the local people involved. Here they are, the nurses being trained again. And you know what amazes me? Whenever you're there or you see photos, they're like around you in MASH. You know, they're so keen to learn. I taught health science students for 11 years. I never quite got them as keen as this. This is one of the young fellows from trainees in Fiji. Every time a team comes, they leave a bit of knowledge behind. I've observed them and then assisted and then operated with supervision. And now I'm able to do some of my own surgeries on my own. Fantastic outcome. Where does the money come from? Well, we get a lot of money, 59% of it, from community and corporate support, including Rotary. So significant. I was going to say that, you know. I'm getting some help from Di, who thinks I might just leave something out. But that's community support. We get other organisations give us 23%, various organisations who want to assist. We have international corporations and trusts, we get about 3%, and other income is about 7%. We get 8% from AusAid. Now, over the last 4 years, we've worked incredibly hard to get what's called full accreditation with AusAid. That is a very demanding process. Only fewer than 30 organisations have full accreditation, and they're organisations like World Vision, CARE, Red Cross. We're a little minnow organisation. We worked our tails off. The staff worked incredibly hard to achieve this, because what it does is it placed an emphasis on our governance. We improved the way we ran it. We improved our risk assessment. We really dragged ourselves up to that top level of those peak organisations. But it also means we get credibility when we go to countries with the ambassadors and the high commissioners, because it's very important we have them involved and interested, because they've got lots of contacts in country. And if we've got accreditation, we're seen as being okay as far as the government's concerned, therefore okay for the commissioners, the high commissioners and the ambassadors to look after us. Here's another example of the sorts of families. I think this has gone out.
Do you want to go to video?
Yeah, in a moment. I just want to go back for a second. When I was visiting Laos, I became quite friendly with the then ambassador to Laos. Subsequently, he left Foreign Affairs and joined PAN Australia. And I thought we should be looking for corporate social responsibility from some of these companies who are working in country. And I talked to him about it, and the staff worked with him, and now they run a program that's supported by PANAUST in Laos, in an area away from the hospital we originally started working in. So when I talk to people, talk to Rotary people, talk to the community, sometimes I know that your Rotary branches support us enormously, but some of you may have friends working in the mining industry. Now, a lot of mining companies in South Australia actually operate in other areas, like Laos and like Papua New Guinea. And just talking to them and saying, does your company do anything in country? In a minute. Anything that is done in, if you can help us in Rotary and Interplast in country, or you might have a son or a daughter who's working in a company and they're looking to do workplace giving. So there are lots of ways that you as Rotarians can help, as well as supporting us with supporting programs. I want to show you the Pan Australia story.
ตะกี้ตั้งแต่เกิดมาเพิ่นให้เป็นแบบแผลอยู่ซกแววเป็นแว่งลงเลยลงไปทางในขึ้น
Dạ thằng đó chị giờ lúc xưa hồi thầu nó no chị cứ món nữa rồi lúc khách tăng chị món nữa rồi dễ trở thành chú ná chị này chị đi vô bài cái sợi chị bài cũ rồi từ cái sáng thu hoạch chú rồi thế đi tàu cũ đi tàu lắm
การเฮ็ดเวียกนี่เนาะมันก็ยุ่งยากสำหรับเฮาเนาะตะกี้จับหยังก็ยากเฮ็ดอันนี้นั่นน่ะเดี๋ยว2เดียวอันนี้เฮาเฮ็ดเวียกน่ะถ้าเฮ็ดเวียกหนักนิดนึงนี่มันมีอาการมึนตามเส้นประสาทแถวนี้เนาะ
ยากบ่ว่าป้อนเขาก็บ่มันอยากออกนะดุนมแม่ก็ดุบ่ได้เพราะว่ามันบ่มีบ่อนอัดถึงนะโอ้ลำบากที่สุด
đời tôi nhỏ chị nhưng chỉ muốn ăn chị nhớ thế tôi giờ thì giờ nó sẽ để cú lên đời chị đến để tôi chị chờ chị cú ở tôiอยู่ยังไหนยาจีกูโยเสียเตียอยู่ใจเที่ยคอตัวตัวโยชัดเตยรงเนี่ยโอ้
เขาเจ้าผ่าตัดนี่มันได้ยากกว่านั้นดีขึ้นหลาย เพราะว่าเดียว2 เดียวนี่นิ่งได้เนาะนิ่งแบบสบายเลยนะ
ก็บ่ลำบากเฮงไปเลยละเพราะว่าหลังจากได้แปลงมาแล้วมันก็กินได้อยู่ได้คือแบบธรรมดาละ
ý là tia nó sát tên nó chị lỡ lại răng no này chờ răng no chị lỡ lại răng no thía lỡ ho lại răng no thía lỡ ho lại răng no chị bé thôi nó chị lấy lại thằng thọ nó những tia thầu là mất lại ta là tàu thì li bé lúc thì trò giả chị rong còn nó sát tên nó chị sát tàu chị này cũng xin họ mó rong còn nó cũng rong ho lụi chị này cũng rong xía thía chị này cũng tia lại cũng ba tàu nó sát tên rong câu thía này.
At PB Mining, we're committed to making a difference to people's lives, a positive difference in the areas that we work. We make numerous donations every year, and we've decided to continue to support Interplast because of the great work and their strong record that they do in remote areas such as Sian Kuang, and they've really made a difference to people's lives. So we're very happy to support something like that.
So Interplast is an organisation out of Australia and New Zealand. They do plastic surgery for people in the developing world. This is the third trip to San Juan province. We have been coming to Vientiane since the mid-1990s. Patients do struggle to make it all the way to Vientiane. It's a long way for some of the remote communities, so being able to come out here means that patients have got access to our services out here in San Juan province. A lot of the deformity that we're treating will affect these people. If they're children, it will affect their ability to socialise and go to school, and some of the deformity will affect adults and their ability to work, and is important, and that's basically what we do.
เห็นว่าผู้เฮาโครงการนี้มาร่วมมือกับพวกเราได้ 2-3 ปีนี้ก็ไปได้ดีและได้ผลดีให้ประชาชนผู้ทุกอย่างโดยเฉพาะผู้ที่บ่มีเงินมีค้ำโดยเฉพาะอย่างเน้นเกี่ยวกับการซิดสอนให้แพทย์ลาวของพวกเขาอยู่ในแขวงเชียงกวงนี่สามารถเฮ็ดได้ผ่าตัดปิ่นปัวนี้ได้
ในหลายปีที่ผ่านมานะเราก็ได้ร่วมเวียกกับพระเจ้าในขณะเดียวกันเราก็ได้เก็บเกี่ยวประสบการณ์ได้ความรู้ของพระเจ้าไล่ขึ้นในการเฮ็ดเวียกของพระเจ้าและให้ได้ความเจ็บปลอดภัย 100%
ปี1988มาพอได้ไปจุกให้แล้วเอาระเบิดแตกชื่อแล้วดีแล้วมันติดกันนาสเก็ตระเบิดอยู่นี้แล้วเจ็ด
เข็นมีโครงการผ่าตัดมาซอยแล้วก็เฮ็ดเวียกง่ายมีผู้ซอยอันนี้เพิ่นเจ็บแล้วอีดูเพิ่น
เรามีปีนึงสร้างยางแล้วไปจับคลิปน้ำหอมมันน้ำหอมรวบมาลมมันรวบตีนเราย่างได้แต่ว่าตีนมันนี่มันขึ้นอันนี้มันก็อันนี้มันสูงในนึง
เป็นมาแต่เกิดน้องเรียนจบแล้วน้องจะเป็นตำรวจแล้วยันเขาเจ้าบ่เอาจึงมาผ่าตัด
เป็นน้ำแต่เกิดท่านมีแต่ศพแดงนี่การยุ่งยากคือการกินการอยู่นี่แหละเนาะอัดศพมันอัดศพบ่ดีเนาะนี่นะ
แพทย์เขาว่าเขาสิผ่าตัดให้เขาสิตัดบ่นี่สิเอาหนังท้องมาติดสาย
ในเมื่อที่ได้รับการบริการโดยเฉพาะการบริเสียค่าในนี้ก็มีความดีใจเนาะซึ่งที่ผ่านมาก็ได้พบคนเจ็บจำนวนหนึ่งที่ว่าได้ไปผ่าตัดที่ผ่านมาเขาก็แสดงความพอใจและก็อยากให้ผู้อื่นที่ว่าบ่ทันได้รับการปิ่นปัวได้รับการปิ่นปัวคือเขาเจ้าคือกัน
รู้สึกดีใจหลายมีโครงการเขาเจ้ามาช่วยเหลือ
เฮามีความรู้สึกดีใจหลายๆที่สุดเปรียบเหมือนกันเลยเทียบบ่ได้แหละเนาะเฮ็ดให้ลูกเฮามีชีวิตขึ้นใหม่ขึ้น
รองเสียมายังรองเสียว่าเจ้าเตียยังทำว่าเราจ่อlò sát thì lò ba bé cho nhẹ nó theo lò ba dạ tiệm nhộn cũng như là cô lò ba bé lại tôi rong bé cũng rong xe và trâu tôi là tiệm cô nhưng mà là ba theo lịch kho tôi bé cho nhộn theo nhưng rong xe cơ.
We provided over $150,000 to Interplast for this program over a 3-year period. This funding has enabled the lives of more than 200 people from Sian Kuang province to be transformed.Thanks to the work of Interplast and the Lao doctors that they've helped to train.
เฮ็ดแล้วนี่ก็สิการกินการอยู่นี่ก็สิสบายเลยเนาะตอนมานี่เขากินข้าวก็ยากเลยงามขึ้นแล้วแหละก็สิลูกก็สิเจ้าชู้แล้วนะ
รู้สึกว่าสิผ่าตัดตีนนี่เนาะให้มันงามขึ้นแล้วก็อนาคตของเราจึงว่าจึงบ่เสียใจให้พ่อแม่
When I hear about some of the great stories of how people's lives have changed after the intervention from Interplast, I think it's something we should all be proud of. PBA Mining that we're able to contribute to something like that.
Not a bad partnership for just a chance meeting with an ambassador who then learned about what Interplast was doing and was able to follow it through when he went to work for a mining company. So you never know when you just plant a seed in someone's mind where it might take them. When you see those changes, that little girl with her finger, it's amazing how many are born with an extra digit and she couldn't work in the police force. I found another little boy who had little toes missing, and they just whipped them off in about an hour, and he sort of bounced back the next day, and the father said he'd now go to school. They wouldn't let him go to school because the devil was in him. So small changes can make huge changes to children's lives. There are those, a couple more little before and afters. There's 3 little siblings, and after their operation. Well, how can you help? As I mentioned, you can help by talking about what we do, about thinking about if there's somebody in your family or your friends who've got a link with a business that might become a partner, or as I said, thinking about whether you know someone in business who could use in their business workplace giving, where you can say how much of your salary, $5 a week, and you get an immediate tax deduction, might be donated. As a district, you could set targets, circulate our material. As a club, you could use this to invite speakers there are surgeons here from Adelaide and South Australia who'd come and speak. You can also give a personal donation, and programs such as the nurses training, which are about $2,000 are excellent value for money too. So there are a range of programs that you can support. Find out more about Interplast on our website, which is constantly being updated, and sign up to the quarterly Rotarian Review, and follow us on social media. You'll see Churia Pitt, the girl who was very badly burnt in a marathon race up in the northwest of Western Australia. She's become one of our ambassadors. She is been very supportive by doing events to the Great Wall of China. She's about to do one for the Kokoda Trail, because the surgeon that looked after her in Sydney is one of our long-standing volunteers, and of course they all spruik to their patients about what they do, and she responded and has been a great ambassador. So you have been a part of a wonderful partnership of 31 years. Rotary should be very proud, because we couldn't do what we do without your support. We get support from other areas, but the Rotary support is absolutely vital, and it's vital too because you talk about it. So thank you very much for your support. I hope that's given you a bit of an insight to what you as Rotarians have been able to achieve, repairing bodies, rebuilding lives, and that's what we've done, and I think we've should have convinced you today that some of those people, or all of those people's lives have been significantly changed, and changed because of your generosity and contribution. So thank you very much.
Well, Kay,